Hello, good day everyone. I am Guadalquiver from BSN 12L Group 46, and so for today, I'm going to perform a proper demonstration about Leopold'S maneuver. So Leopold'S maneuver is a systemic palpation of the abdomen in assessing the fetal presentation and position. So first and foremost is we need to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. And next is we need to prepare the equipment to be needed. So first is we have the pillow, we also have the folded towel, and the stethoscope. So I already closed the door, fixed the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. So hello ma'am, good day. How are you feeling today? Okay, great. So it is important to greet the client in order to establish a good rapport between the healthcare provider and to the patient. So ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? Okay, when is your birthday? How would you like me to call you? Okay, so Ma'am Jenny, the procedure that I'll be doing is I'll be doing a Leopold'S maneuver. So this is to assess the fetal presentation and position of your baby. And also, I will be touching some parts of your body and there are certain procedures that you need to follow. Is that okay with you, Ma'am Jenny? Any concerns or any questions? Okay, great. So, Ma'am Jenny, before we will start our assessment, I encourage you to vote first in order to avoid any interruption during our assessment. Okay, so because a distant bladder may deviate the uterus. So, Ma'am Jenny, are we okay now? Can we start the assessment already? Okay, let's go. So now, position the patient on a supine position with one pillow under her head and with knees slightly flexed. So this is to facilitate accurate assessment and providing comfort, and flexed knees can relieve the tension of abdominal musculature. So Ma'am Jenny, I will put a pillow under your head. Okay, and kindly flex your knees for me please. Okay, thank you. And now place a rolled towel under the patient's right hip. So Ma'am Jenny, I'm gonna put a folded towel on your right hip, okay? Thank you, Ma'am Jenny. So this is to shift the uterus away from the large blood vessels and thus prevent the supine hypotensive syndrome. If right-handed, stand at woman's right facing the patient. This is to easily grasp the symphysis pubis, to be done in the third maneuver. So now slightly lift her shirt and expose only the specific area and ask the permission of doing so and slightly flex the knees. So okay, Ma'am Jenny, I'm going to lift up your shirt. Is that okay with you? Okay, thank you. Okay. So now we are going to perform for the first maneuver, which is the fundal grip. So this is to determine whether the fetal head or breech or the buttocks is in the fundus. Now, face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So Ma'am Jenny, I'm going to palpate your abdomen. Is that okay with you? Okay, thank you, Ma'am Jenny. So, okay, the head feels hard and round, and it freely movable and ballotable breech and feels softer and nodular. Okay, so now we are going to perform for the second maneuver, which is the umbilical grip. So this is to determine the position of the back. Palpate in a downward direction of the sides of the abdomen, applying gently but deep pressure to determine the position of the fetal extremities and the fetal back and the anterior shoulder. So palpate with one hand steady on one side and other hand exploring on the other side. If fetal back along continuous structure will be felt. If extremities, it will feel nodular, reflecting to the portion of the fetal extremities. So now we are going to perform for the third maneuver, which is the Leopold'S grip. This is to determine the presenting part and if engagement has occurred. So place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and fingers to feel the presenting part. Okay, so the head is inlet or in the pelvis in zero station if presenting part is still movable and not engaged. So now we are going to perform for the last maneuver, which is the pelvic grip. So turn and face the women's feet to confirm for the findings of the third maneuver and determine the flexion of the vertex. So move the fingers of both hands and gently down the sides of the abdomen towards the pubis. And now locate again for the back of the fetus and place a stethoscope over and listen for the fetal heart tone for 1 full minute. And now, note the location, rate, and character of the fetal heart rate. So in cephalic presentation, the fetal heart rate can be heard either left or the right lower quadrant or abdomen. So if breech, fetal heart rate can be heard above the level of the umbilicals, either on the right or the left. And lastly, make the patient comfortable. This is to promote the ease and relaxation. And document the observation made, the fetal presentation, position, the attitude, and whether they engage and floating. So, okay, Ma'am Jenny, we are done conducting with our assessment. So, Ma'am Jenny, the documentation that I have is that I see that your baby is in the right side. And also, your baby is in the cephalic position, which is a ideal position for the baby. And the fetal heart rate of your baby is 120 beats per minute, which is normal. Overall, the findings is normal and good. Okay. And also, don't forget to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. Okay, Ma'am Jenny, we are done with our assessment. Thank you for your time and cooperation, and have a nice day. And that's it. That's the proper demonstration about Leopold'S maneuver.